Good morning. I am very grateful for the opportunity to share my perspectives on this issue, which I think is very important for everyone, even those of us who don't quite know that it affects us yet. I think Rosalind Carter says it best when she says there are only four types of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. And I must say, I wake up every morning thinking about that quote. For the past 10 years, family caregiving has been a big part of my life. Like Mr. Martinez yesterday, I'm a repeat caregiver. I first cared for my mother, who had cancer, and a couple of months after she died, my father got sick. He developed a heart problem. He was in his 70s, his late 70s at the time, and had never had any health problems, had never been on any type of medication, had never dealt with a serious illness before. I suspect that his heart broke because, along with me, he was a caregiver for my mom. In any event, that series of events really changed the trajectory of my life and how I think about caregiving, even though it's something that's been a part of my life since I was a baby. According to my mom, my grandfather came to live with us when I was just a baby. I don't know what his health condition was, but his aging process took the same trajectory as many of the people in the rural neighborhood that I grew up in. When he was no longer able to stay home, he went to live with a family member. In this case, my family, my mother, who was his daughter, took care of him while she raised her baby, me. And when that was no longer feasible, he went into a nursing home. Fast forward, that was almost 40 years ago. Fast forward 10 years later, the trajectory of care for people in my neighborhood hadn't changed much. When I was in college, pardon me, 20 years later, when I was in college, my grandmother had a stroke. And my family helped her stay at home as long as was possible. And eventually she also moved in with us. And while I was home for the summer working, my mother and I split caregiving duties. We both worked during the day, and a home health agency sent an aide to stay with her while we were at work. And whoever got home first, it was usually me, took care of her until my mom got home. At the time, there wasn't a lot of competition in terms of home health agencies. In fact, there may not have been any competition at all. I only remember one agency which served a pretty broad multi-county area. And that experience actually shaped how my family felt about home health for a while. And it wasn't necessarily a positive experience. I mean, it helped in that we could continue to work, but we were concerned about the skill and the quality of the care that she received. And for others in the community, we heard even worse stories about fraud, abuse, that type of thing. So home health kind of had a bad connotation for us. Fast forward another 10 years, when my mother got sick, she was in her early 60s. She was just 61 when she passed away. And paying for her care at home was private pay. We didn't have to worry about benefits. Well, she wasn't eligible yet for anything, and she did have private insurance, and again, private pay helped take care of things. And it also helped that I was able to take a leave of absence from my job to help care for her the last couple of months from her life. At the time, I was an attorney here in D.C., right on K Street, in a large firm, and I was able to take advantage of FMLA leave to be with her. That's when my perception of home health began to shift, because the last time she was discharged from the hospital, it was with the knowledge that she was going home to die. And it was very comforting for my family to have the help of hospice. They came in and they sat at the hospital bed in the bedroom. A nurse and a caseworker came by a few times a week and really helped me understand what was going on and recognize the signs of her decline. Fast forward a couple of months after her death, when my father got sick. I did not see that coming. I don't think you ever see that kind of thing coming, but certainly not that quickly. I was still winding down my mom's estate. We had buried her, and I was returning back to work when my father became ill. And it never really crossed our minds what would happen after he left the hospital. And part of the reason for that is that he had another daughter, my big sister, who was an RN. And even though I had pretty much exhausted all the FMLA leave available to me, she was able to take him home with her. And so he stayed with her for several weeks until he went back to his own home. And it was such a difficult time because he had lost so much of his independence. He had lost the love of his life. He was no longer able to work. He was a logger, so up until his late 70s, he was going out into the woods chopping down trees every day. So being able to use that, and not having his physical strength, was very devastating for him. So he wasn't able to work. He lost his health, which he had always had, and his strength, which he had always prided himself on, and he had lost his spouse. So it didn't really occur to us to do anything that would disrupt his expectation of how he would grow old any further. My mother was significantly younger than him, so the expectation was that she would always take care of him and that he would age in place. So we did our best for several years to help honor his wish to stay at home. And in retrospect, it would have helped us tremendously to look at what the range of options that were available for us in terms of home health. My dad was a little particular about how he wanted to be cared for. Even between my sister and I, he preferred that I do certain things. He preferred that my sister do certain things, and that was just how it was, and we didn't want to disrupt his expectations that much, but it did become a burden to me. It was not uncommon for me to come out of a meeting to a voicemail that my dad was on his way to the emergency room. I spent several weekends. I would say at one point I went home, and it was a 4-hour drive to where he lives from Washington, D.C. I would go home every weekend for a long time, and then eventually I could cut back, but I still went home multiple times a month. And it just became too difficult to have two responsibilities, actually three if you count my own household. It became a little too difficult to feel like I was juggling things effectively, even though I guess in retrospect I was doing fine. But I was just always unsettled. And I never felt like I was doing a good job by anyone. And eventually I decided to make a choice. And of course, I decided in favor of my dad, and I left my job. And the financial repercussions of that continue to this day. That was back in 2009 when I made that decision. At the time I was married. I'm not anymore. And I don't regret my decision, but in retrospect, I would have made different choices, especially given all that I know now about the options that home health provides for people. And especially since I've had an opportunity to witness that. Earlier this year, my father was diagnosed with dementia. And we did rely on home health. We had no choice. My sister at the time was on medical leave herself, so she couldn't. It wasn't feasible for her to plan to take additional time off to help him get settled. And I am just not in a position to stop working again. So we ended up relying on a home health agency to send in home health aides, and he needed 24/7 care. And we did not look at this as a long-term solution. It cost us about $400 a day to have someone in the house. And at the time, we were applying for Medicaid benefits and for my father. And he primarily received his health care from the VA. He was a Korean War veteran. So that was a great help to us. He had applied for aid and assistance, and it came through at just the right time to begin to help out, but still the expenses were quite enormous. So it helped to have home health aides in the house with him, because I was back and forth from work. I couldn't take months off. I couldn't take weeks off. Usually I would come down a few days every week. And it was a difficult time for him because he was coming to grips with his diagnosis. And having me in and out was not necessarily the most comforting thing. And that was upsetting to me because I was used to being of some comfort from my dad. So it helped having the home health aides there for continuity. He got to know them, and he got to like them. And they actually brought me peace of mind because unfortunately not everyone in the world is scrupulous. And they reported some things to me about neighbors who were trying to take advantage of him. And it helped to know that I had eyes and ears to not only look after his medical situation, but also his well-being in other ways. We looked into having him go into the PACE program, and Dr. Lander said something yesterday about the humility of having a home health professional or a medical professional come into your home. And that was such an amazing experience for us because to have two representatives from our local PACE program come in and do an evaluation for him and have an honest conversation with us about our options and make us come to grips and actually feel better about the decision that we had to make, which was that my dad could no longer stay at home. It just wasn't safe for him. You can't guarantee that someone's always going to be around, that the home health aide worker is going to be able to make it to work. You can't guarantee that the Medicare nurse who comes out and checks his vitals every few days is going to be able to make it, and she's only coming for a little while anyway, or that the therapist that was also provided, the physical therapist who also came out a few times a week, you can't rely on all of that, especially given the winter that we had last year. So it was helpful to have people very compassionately describe that to us and help us to feel better about the choices that we were going to have to make. So we puddled along while we got things set up the best that we could, and eventually transitioned him out of his home. And I still struggle a little bit with that. I feel bad that all of this effort, leaving my job, all of the trips up and down 95, and ultimately his wish of being able to stay at home couldn't come true. But every time I see him now, he looks healthier. His medication is being managed properly. He's gained his weight back. He smiles, and he's happy, and he's not scared anymore. And I really do credit home health for helping us cross that bridge. If I could just say one more thing, I would probably add a fifth person to First Lady Carter's scenario of caregivers. I would add people who have to work with a caregiver, and that would include my former boss, who was very sad to see me go. That would include my coworkers who had to help me pick up the slack, honestly, on the days when I got called out of meetings to head down 95 to an emergency room. That would include the healthcare professionals who had to tell us about my dad's diagnosis while he was sitting there in the room. It would include the social workers who had to pretty much break the news to us about how difficult this would be, honoring my dad's wish would be, especially the PACE representatives I mentioned. So I'm very happy that we're here talking about this issue today, and I hope that my reflections on my past can give a face to and help inform the discourse about the future of home health.
So Karen, thank you so much for describing to us sort of the different touch points you've had with different kinds of home-centered care, to use Steve's term. So we really appreciate that.
Thank you.
Thank you.